All right, welcome back to the sixth video and probably the last video on path anatomy, KROK1. You are watching Row1 TV. Row1 TV. And if you are new to this channel, kindly subscribe to it and share as well. All right. So we ended on 150, so we are on 151. Autopsy of a 67-year-old man who died of hypoglycemic coma, that means low glucose content in the blood, has shown the areas of connective tissue excrescence, necrotic focuses, and the atrophy of islet of Langerhans in the pancreas. Now, atrophy of islet of Langerhans in the pancreas usually denote diabetes mellitus. Diabetes mellitus. All right, 152. The thyroid gland of a patient is twice enlarged. Palpation shows a solid gland with irregular tubular surface. Histological examination detects diffuse infiltration of the tissue by lymphocytes, plasma cells with the formation of follicles and intensive excrescence of the connective tissue. What disease do these facts indicate? Now, microscopically, Hashimoto thyroiditis is characterized by extensive infiltration of the gland by lymphocytes, plasma cells, immunoblasts, macrophages with formation of lymphoid follicles having germinal centers. There is also decreased number of thyroid follicles, which are generally atrophic and are often devoid of colloid. Now, this is simply telling us that our answer is Hashimoto thyroiditis. Hashimoto thyroiditis. All right. So 53. In the post-operative thyroid gland biopsy, among the follicles filled with colloid lymphoid structures with growth centers were histologically detected, diagnosed the disease. This is talking about Hashimoto thyroiditis again. So the same as previous one. The same as previous one. 154. Examination of a patient who lives in the mountain region of Middle Asia shows the enlargement of the thyroid gland that makes swallowing difficult and increased weight. Now, persons living in these areas, usually they are devoid of iodine, thereby leading to the enlargement of the thyroid gland. And disease of this nature, we usually call it endemic goiter. Endemic goiter. So your answer is A. 155. Histological examination of a thyroid gland detects moderate atrophy of the parenchyma, sclerosis, and diffuse infiltration of the stroma by lymphocyte and plasma cells with follicles formation. This is talking about Hashimoto, also known as autoimmune thyroiditis. Autoimmune thyroiditis. That is A. 56. A 60-year-old woman had a thyroidectomy done. Histological examination of the thyroid gland detects big follicles of different size with a foamy solid colloid. Follicular epithelium is high and forms papilla in some places. Stroma has a focal lymphocytic infiltration. Diagnose this disease of the gland. Now, this is actually typical for diffuse toxic goiter, also known as Graves' disease, which is characterized by the epithelium proliferation with formation of papillae, colloid vascularization, lymphoid plasmocytic infiltration, formation of lymphoid follicles with germ centers, and so on and so forth. Therefore, our answer is A. 57. A patient who used to be ill with hematogenous tuberculosis has hypermelanosis of the skin. Usually, hypermelanosis occurs when there's deficiency of adrenal gland production or hormones production. And this is also called what? Addison's disease. It's also called Addison's disease. So your answer is A. 58. Gradually, the patient's feet, right hand, nose, and lips began to increase proportionally. When there's increase of bones in size, what it means is that there's a lot of growth hormones being produced, and that terminology is called acromegaly. So your answer is D. Growth of these bones. 59. Autopsy of a man who died of cachexia has shown parathyroid glands adenoma. Parathyroid glands adenoma. Parathyroid is responsible for the production of what? Calcium. As a result, there's deformity of bones, especially of the extremities, spinal cord, and the ribs. The bones are soft, porous, easily cut. What is the most possible diagnosis? Of course, we are talking about what? Parathyroid osteodystrophy. That is A. 160. Autopsy of a man who has shown a bronze color of skin. Now, bronze color of skin is also another name for hypermelanosis and tunica mucosa of the mouth. There are caseous masses in the adrenal glands. What disease? Of course, Addison's disease. Addison's disease. 61. Autopsy of a dead 73-year-old man has shown an enlarged, soft, elastic tuberous prostate. On the cut, it consists of single nodes separated by connective tissue layers. Microscopical examination detected the increment of glandular element. The size of the lobules and the amount of glandular element are different. What process is the most possible? Of course, we are talking about what? Glandular nodular hyperplasia. 1. There was what? Increment of glandular elements, and 2. There was the presence of what? Single node. That is why I went for what? Glandular nodular hyperplasia. I'm sorry if I'm too fast, but we don't really have much time. So if I'm too fast, it's a video, so just kindly go back and play it again. That's why it's a video. Make it easier for us. Okay. 162. Histological examination of the urine mucosa detects sinus glands, sawtooth, and corkscrew-like extended excrescences of the stroma with the proliferation of 8 cells. What is your diagnosis? This is definitely what? Hyperplasia of endometrium. Therefore, it is called glandular endometrium hyperplasia. So your answer is E. 63. A patient had an operation on the uterine tumor. A macrospecimen is a spongy mottled node in the myometrium. Histological examination detects giant light epithelial cells, among which there are many dark polymorphous ones. Stroma is absent. Vesicles look like lumens covered with tumor cells. Multiple hemorrhages are detected. How can we term this tumor? This can be diagnosed as chorioepithelioma. Now, this occurs as a malignant fast tumor that develops from trophoblastic cells. And these are cells that help an embryo attach to the uterus and help to form its centers. It has no stroma. Therefore, our answer is A. Answer is A. 164. Microscopic examination of the umbilical vein of a newborn who died of intoxication detects diffuse inflammatory infiltration of the wall. Its lumen is obturated by a thrombus with numerous neutrophilic leukocytes with KROK1 signs and bacterial colonies. Now, KROK1 simply means destruction of the nucleus of a dying cell. Destruction of the nucleus of a dying cell. So what is the most possible after effect of the thrombus? Usually when we talk about wound intoxication, it is due to what? Sepsis. This is due to sepsis. So what is our answer? Of course, answer is septic lesion. Septic lysis. 65. Autopsy of a 50-year-old woman who died of uremia has shown adenoma of parathyroid glands, deformation of limbs, spinal cord, and ribs. The bones are soft. On incision, they are of increased porosity with tumor-like nodules, which have mottled look like and contain what says microscopic examination detects a noticeable change of bone structures, focuses of lacunar resolution of osteal and fibrous tissue. What is the most possible disease? Now, most of us will probably get this one wrong. Yeah. But the answer here is von Recklinghausen's disease. You get me? Don't ask me to repeat that. Now, this is a disease. This is a genetic disorder which is characterized by the growth of tumors on the nerves, and it can affect the skin and cause bone deformities. So your answer is A. This could have also been a parathyroid osteodystrophy. Parathyroid osteodystrophy, as it was in the previous question. However, this is their answer. So we go by it. 66. A 32-year-old woman died during the puerperal period. Autopsy has shown the signs of suppurative endometritis, purulent thrombophlebitis of uterine veins, numerous abscesses of lungs. Anytime you hear of numerous abscesses of lungs or multiple abscesses of lungs, we are usually talking about what? Septicopyemia. So your answer should be A. 67. During an operation on a 39-year-old woman, an enlarged uterine tube and a part of the ovary with a big cyst were removed. Examination of the mucous membrane of the tube wall detected decidual cells and chorionic villi. What is the most possible diagnosis? Now, the presence of decidual cells and this chorionic villi indicates the presence of what? Pregnancy. Now, and since this pregnancy is actually taking place in the uterine tube other than the uterus, we call it tubal pregnancy. Tubal pregnancy. So your answer is C. Okay, infectious diseases. So 168. Autopsy of a young man who died being in coma has shown extensive thromboembolic infarction of the left hemisphere. Anytime you hear something like this, know that there's a blockage somewhere or there's an infection somewhere. Large septic spleen, immune complex glomerulonephritis, and ulcers in the aortic valve hidden by polyp-like thrombi with staphylococcal colonies. What disease led to the cerebral thromboembolism? This is this would be septic bacterial endocarditis. However, now, according to the clinical morphological terms of sepsis, we have septicemia, septicopemia, septic endocarditis or septic bacterial endocarditis, and we have chronic septicemia. Already you know what septicopemia is. You already know what this is. So what then is septicemia? Septicemia is usually characterized by toxicosis, that is high temperature and delirium, increased reactivity of the organism, but absence of purulent metastasis. All right. Now, septic bacterial endocarditis is characterized by lesions of valves of the heart. Valves of the heart. So your answer is A. 169. A patient who had used drugs for a long time had fever, signs of intoxication, prior, echocardioscopy detected massive thickening on cardiac valves. Staphylococcus was cultured in blood. The patient died of pulmonary artery thromboembolism. Wow. Indicate the heart changes that were detected during autopsy. All right. Now, this is an ulcerative type of endocarditis due to the massive thickening on the cardiac valves. Hence, our answer should be endocarditis polypoulcerosa. So the answer is A. Medicine. Anyways, 170. An injury of an extremity caused long-term maturation and the patient died against the background of intoxication. Autopsy has shown general exhaustion, dehydration, brain atrophy of the liver, myocardium, spleen, striated muscles, amyloidosis. How is this disease diagnosed? Now, this is a type of chronic septicemia. Yes, chronic septicemia. Now, we have extensive purulent processes, which is causing intoxication and amyloidosis. Atrophy, dehydration, and decrease in spleen are also marked. Therefore, your answer should be D. Chronic septicemia. Chronic septicemia. 71. A patient fell ill with diphtheria. The second week of the disease, acute heart failure developed and caused death. Autopsy has shown dilated heart ventricles, mottled, flaccid myocardium, histological numerous small foci or focuses of myelolysis with small perifocal lymphoid infiltration have been detected. What caused the acute heart failure? Alright, now the cause of the heart failure may be due to the treatment of the diphtheria. Don't forget, the patient was ill about a week ago. Therefore, we can easily diagnose if it is because of the drugs, then it could be what? Exotoxic. Exotoxic. So therefore, our answer should be bacterial exotoxic myocarditis due to the treatment, the drugs used. So the drug could be exotoxic. So the answer is E. Okay. Where am I? 72. Autopsy of a dead 18-year-old man has shown a mirror spleen weighing 580 grams with a big smear of pulp. Histologically, a significant proliferation of reticular cells, the presence of numerous mature neutrophils in sinusoid capillaries have been diagnosed. How can we term such spleen? Now, the production of large strip of pulp by the spleen is termed as septic splenitis. Septic splenitis. That is why the answer is B. B. All right. Now, tuberculosis. Autopsy of a dead child has shown a primary intestinal tuberculosis complex. Primary affect ulcer of the jejunum, lymphadenitis, and regional caseous lymphadenitis. The death was caused by ulcer perforation and diffuse peritonitis development. Name the way of child's contamination with tuberculosis. Now, the mode of transmission of tuberculosis include inhalation, ingestion, inoculation, and transplacental. All right. Now, with the presence of ulcer in the jejunum means ingestion. The person took in. The mode of transmission was through what? Ingestion. If it's through ingestion, then it is called what? Alimentary. Therefore, the answer is B. Alimentary. 74. Autopsy of a 17-year-old girl who died of lung insufficiency has shown confluent areas of caseous necrosis, signs of caseous necrosis in bronchopulmonary, bronchial, and bifurcation lymph node. This is the bronchial tree. So what is the most possible diagnosis? Now, this can be diagnosed as a childhood tuberculosis, also known as primary tuberculosis, because of the growth of injury. Because the growth of injury is characterized by the enlargement of caseous necrosis, which erodes the bronchial tree and what spreads. So this, my answer will be childhood tuberculosis or primary tuberculosis. Okay, that should be D. Sorry, I don't know why this thing is turning this way. Okay. Autopsy of a 44-year-old man who died of pulmonary heart insufficiency has shown pneumosclerosis, emphysema of lungs, hypertrophy of the right ventricle of the heart. Multiple foci of 1 centimeter in diameter are localized in both lungs, mostly subplurally. Histologically, in the center of the focus is the area of necrosis. On the periphery, a bank of epithelioid cells and lymphocytes with a few macrophages and plasma. Giant cells were present. Anytime you hear of giant cells, something to tell you. So what disease did the man have? This is hematogenous tuberculosis. It is characterized by proliferative reaction or formation of granulomas and hematogenous spreading. So granulomas, giant cells, indicate what? Granulomas. So due to the presence of the giant cells, among others, our answer is A. 76. Autopsy of a 48-year-old man who died of pulmonary tuberculosis has shown partly emptied symmetric tuberculous caverni in corticopleural areas with the domination of productive tissue reaction, delicate reticulated pneumosclerosis and emphysema in lungs, pulmonary heart, and tuberculous caseous lymphadenitis in bifurcation lymph node. Cohn's focus is located in the third segment of the right lung. What is the most possible diagnosis? Now, Cohn's focus means primary tuberculosis. Hence, this is a post-primary tuberculosis which consists of secondary and hematogenous tuberculosis. Now, the development of pneumosclerosis, the emphysema of the lungs, cor pulmonary, that is hypertrophy of the right ventricle of the heart, and proliferative tissue reaction is characteristic of hematogenous disseminated tuberculosis. So your answer should be B. 77. Microscopic examination of a 52-year-old patient's lungs detects focus of necrosis surrounded by a bank of epithelioid cells and lymphocytes, giant round cells. Giant cells. So what are you thinking of? Tuberculous granuloma. Tuberculous granuloma. All right. 78. 40-year-old prisoner died in a lung settlement of tuberculosis. Autopsy has shown the deformation and reduction of pulmonary apices. Numerous cavities with solid walls 2 to 3 centimeters thick in the upper lobe of the lungs. Disseminated focus of caseous necrosis in the lower lobes. Diagnose this form of tuberculosis. The presence of the cavities makes it easier to diagnose this as a cavitary secondary tuberculosis, and hence in this case our answer should be secondary fibrocavernous. Secondary fibrocavernous. Your answer is E. 79. A 50-year-old man was ill with tuberculosis and died against the background of pulmonary heart insufficiency. Autopsy has shown the lobar character of pulmonary affection. The upper part is enlarged, yellow on incision, friable with fibrinoid thickening on the pleura. What form of secondary tuberculosis does this pathology belong to? Now, your answer should be tuberculoma, or it is tuberculoma. Now, a tuberculoma consists of focus necrosis surrounded by fibrous capsules with size about 2 to 5 centimeters. Fibrofocal tuberculosis, this one, forms due to intensification of acute local tuberculosis with formation of fibrous capsules. Now, infiltrative tuberculosis is characterized by the extension of perifocal inflammation, whereas gaseous pneumonia develops due to progression of infiltrative tuberculosis. So your answer is no, it can't be tuberculoma. This should be D. Yeah. Answer is caseous pneumonia, not tuberculoma. Sorry for that. Because tuberculoma actually consists of what? Focus necrosis surrounded by fibrous capsules. That is not the description over here. However, let's go to 180. Autopsy of a dead 48-year-old man has shown a round formation nearly 5 cm diameter with clear contours surrounded by a thin layer of connective tissue and filled with masses in the area of first segment of the right lung. This is definitely tuberculoma based on what I explained earlier on. All right. 81. A patient who died of pulmonary tuberculosis has a white-gray focus surrounded by a capsule. That's fibrous tissue. Microscopic examination detects a focus of necrosis with a capsule and the absence of perifocal inflammation. This is definitely tuberculoma. So what's your answer? 181 should be good. A. 82. Autopsy of a woman who died with a clinical diagnosis of chronic pulmonary abscess has shown a round cavity with a round cavity inside second segment of the right lung. The internal surface of the cavity is formed of caseous masses. The external one of solid pulmonary tissue. Pyogenic membrane is absent. What process is meant? This is definitely acute cavernous tuberculosis. Acute cavernous tuberculosis. Why? It is characterized by what? The lesion of caseous necrosis and formation of round cavity. Don't forget that. So the answer is C. 83. A 14-year-old patient was diagnosed a Hutchinson triad. Anytime you have Hutchinson triad, please, your answer is syphilis. Thank you. So it's A. 84. An 18-year-old patient has enlarged inguinal lymph nodes, painless, solid when palpated. A small ulcer with solid margin and varnished bottom of grayish color is in the area of genital mucosa. Diagnose this disease. Another syphilis. Yeah, syphilis. But it's painless. And there's ulcer in the genital mucosa. 85. Painless ulcer. Painless ulcer with smooth varnished bottom and margins of, the same as previous. So the answer should be what? Syphilis again. So it's D. 86. An ulcer of oval form with slightly raising edges and cartilaginous infiltrate is on the mucous membrane of the patient's cheek. The bottom of the ulcer is of milky red color, covered with greenish, greasy incrustation. Microscopic examination detects lymphoplasmocytic infiltrate, mostly around small vessels with endothelium proliferation. Of course, syphilis again. Syphilis. Why? The bottom of the ulcer is of milky red color, covered with grayish, greasy incrustation. The answer is E. 87. A microscopic examination of the biopsy material taken from the oral cavity has shown focus of caseous necrosis surrounded by plasmocyte, epithelioid, and lymphoid cells, and occasionally by giant, small vessels with the signs of endo and perivasculitis can be seen. Term this disease. Well, this is a granulomatous disease, definitely. But I'll go for E. So your answer is E. Syphilis should be the most correct answer. Sometimes they are close. 88. A round formation 0.5 centimeters in diameter was detected in the hepatic tissue. Microscopically, it has the following structure. Necrotic masses in the center are surrounded by a granulation tissue with plasma and lymphoid cells and blood vessels that have the signs of vasculitis. What disease must we diagnose on the basis of microscopical examination? Now, this is a form of tertiary syphilis called gummas. 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 Singular gumma. Which is a localized area of necrosis which may affect large parts of any organ or tissue, by particularly bones, testes, and liver, and it looks like white, gray, and rubbery formation. Now, this is therefore a solitary hepatic gumma. Solitary hepatic gumma. That is the one closer to our definition. A 38-year-old man died trying to lift weights. Collaptoid state had developed. Autopsy has shown a rupture of extensive thoracic aorta aneurysm. During his life, the patient had visceral syphilis. What pathological process caused the atrophy of the aortic wall, its dilation and rupture? Now, this is aortic wall. An aortic wall is the biggest artery, and it is made of mainly elastic fibers. Therefore, this is this solution of elastic fibers. So your answer is C. 90. A microscopic examination of the biopsy material taken from the liver has shown granulomas. They consist of plasma, lymphoid, giant cells, small vessels with signs of blah 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 blah. What is your answer? This is syphilis, just like the previous question. So it's A. 91. A patient died of intoxication on the 4th day after eating uncooked eggs. Anytime you hear of uncooked eggs, an infectious disease, think of what? Salmonellosis. Now, autopsy has shown numerous stomach and intestine has shown signs of inflammation and is covered with mucous exudate. Abscesses have been detected in the lungs, brain, and liver. This should really be what? Septic. So this is what? A septic form of salmonellosis. So your answer is B. 92. Numerous oval ulcers located along the distal part of the small intestine. Okay. Were detected during the autopsy of a man who died of diffuse peritonitis. The bottom of the ulcers is clean, flat, formed of muscular or serous membrane. The edges of the ulcers are even and round. 2 ulcers have perforated. Oh, this is definitely talking about typhoid fever. Typhoid fever. So your answer should be A. Typhoid fever. Because the Salmonella typhi abdominis has a very high perforation power, and if left untreated, it can cause a lot of damage. And they are also mainly located in the distal or the terminal part of the intestine. So your answer is A. 93. Few ulcers 4 to 5 centimeters in size were detected in the terminal part. Come on, think of typhoid. Terminal part is A. 94. The death of a 16-year-old patient was caused by diffuse fibrinoid purulent peritonitis. Autopsy has shown an ulcer in the lower part of the small intestine. Come on, which represents the form of Peyer's plaque with intestine wall perforation. Again, typhoid. It's your guy. So your answer is A. 94. Oosh. Okay, that was 94. Now 95. Autopsy of a dead man who was ill with typhoid has shown the following changes in the small intestine. We have enlarged group lymphoid follicles rise above the surface of the mucous membrane of gray-red color, succulent. Their surface looks like convolutions and grooves. Microscopical examination detects the formation of typhoid granulomas. What stage of typhoid is this picture typical of? Alright. Now, there are 5 stages. 5 stages of typhoid changes. 1. We have what we call the medullary or the medulla swelling. This is characterized by the development of typhoid granuloma. Typhoid granuloma. We have necrosis. Necrosis is characterized by the formation of necrosis and ulceration. We also have 3. Ulcer formation. Of course, this type of ulcer has unclear ulcers or unclear edges. Then we have clean ulcers, where the ulcers are regular without necrotic tissue. And finally, we have healing. Healing when the granulomas are sclerosized. Alright, so with this, with the formation of typhoid granulomas, we are talking of what? Medullary swelling or the medulla swelling. So your answer is C. C is your answer. 96. A patient died in the 3rd day after the operative perforation of the large intestine. Large intestine, talk about the colon, with the signs of diffuse purulent peritonitis. Autopsy has shown thickened mucous membrane of large intestine covered with fibrinous membrane. Single ulcers penetrate to different depth. There's necrosis of the mucosa, fibrin, leukocytic infiltration, hemorrhages, complication of what caused the death of this patient. Now, infectious disease of the large intestine or the colon is usually by what we call shigellosis. So this should be what? C. Complication of shigellosis has led to the death of this patient. Multiple red ulcers of irregular form were detected in the sigmoid. Sigmoid colon is also part of what? The large intestine. So you are thinking of what? Shigellosis or Shigella. Alright. Autopsy, mucus. So your answer is what? Shigella. C. 98. A 50-year-old man who seriously fell ill was diagnosed Shigellosis. He died on the 7th day of the disease. Autopsy has shown a thickened wall of the sigmoid colon and the rectum initial part, a fibrous membrane of the mucosal surface. Histologically, deep necrosis of the mucous membrane with fibrin infiltration of necrotic masses were detected. What kind of colitis is meant? Obviously, this is a fibrinoid necrosis, which could be Croup-Hous or diphtheric. But over here, our best answer should be what? Diphtheric. They didn't bring Croup-Hous to confuse us. Your answer is A. Okay, viral infections. 99. Don't worry, we are getting there. A 67-year-old patient had a severe form of and died of it. Autopsy has shown black lungs. Microscopical examination detected sharp vessel plethora, hemorrhages, pulmonary tissue edema, and exudate in the lumen of the bronchi and alveoli containing mostly erythrocyte. That's blood. What type of inflammation do these morphological changes indicate? This is indicating what? Hemorrhagic. So hemorrhagic bronchopneumonia. So the answer is A. Question 200. 200. A 42-year-old man died against the background of signs of severe intoxication and respiratory compromise. Oh. Microscopically on the cut, the pulmonary tissue of all the lobes is variegated with multiple and small tuberous hemorrhages and emphysema focus. The surgical examination detected hemorrhagic bronchopneumonia with abscess formation, eosinophilic and basophilic inclusions in the cytoplasm of the bronchial epithelium. Diagnose this guy. This is talking about influenza. Influenza, typically for influenza. A 30-year-old man was ill with acute respiratory disease and died against the background of signs of acute pulmonary insufficiency. Autopsy has shown fibrinous hemorrhagic inflammation on the mucous membrane of the larynx and trachea, destructive bronchitis. Lungs are enlarged and variegated. And because of abscesses, hemorrhages, and necrosis, what is the most possible diagnosis? Same as above. So your answer is what? Influenza. D. Okay. Now. Where are we? Sorry, guys. Okay. I think we are on the 203. 202. Sorry, guys. Autopsy of a dead 44-year-old man, citizen of Ukraine, has shown a combination of pneumocytic pneumonia, Kaposi sarcoma, B-cell lymphoma. This person is so. So the answer is what? HIV infection at ACE stage. So the answer is B. 203. A pathological examination of a dead 30-year-old drug user with HIV infection has shown that lungs are thickened of deep gray color, low areal interalveolar septa are densely infiltrated with leukocytes. A part of alveolar site are transformed into big cell with a round nucleus located in the center with light bordering that looks like an owl's eye. Owl's eye. If you see this guy, they are talking about what? Cytomegalovirus. The answer is what? C. Children's infection. An 18-year-old teenager fell ill seriously. How can an 18-year-old be a child? Anyway, and died of infectious toxic shock. Autopsy has shown the enlargement of tonsils covered with gray-white membrane that spread to the palatine arches, the edema of the soft tissue of the neck. Physical examination has detected the necrosis of tonsils and arch epithelium. Underlying tissues are sodden with fibrous exudate that forms massive thickening on its surface. So, diagnose the disease. This is hysteric. Yeah, because of the massive thickening, it is not easy to remove this fibrous tissue or this fibrous necrotic or fibrous plaque that has been formed on the tonsils and on the arcs accordingly. So your answer is what? Diphtheric. E. 05. 7-year-old child had a sore throat and high temperature on second day of the disease. Red eruption like small densely located stains of poppy seed size was noticed. It covered the whole body except nasolabial trigone. Examination of the oral cavity detected bright hyperemia of the fauces, enlarged tonsils, crimson red tongue. What is your diagnosis. Now, during the first few days of scarlet fever, it manifests itself as catarrhal tonsillitis, that is, hyperemia of the pharynx with involvement of the oral mucosa and the tongue. So, therefore, our answer is scarlet fever. So, A. 206. During the autopsy in the liver was detected a bladder-like formation with flat surface 5 centimeters diameter, great amount of small vesicles with transparent colorless content in its cavity. The liver tissue around the bladder is sclerosized. What is the most possible diagnosis for this guy? Okay, for the formation of a bladder-like formation with flat surface, please, this is hydatid echinocosis. Echinocosis. So it's D. 07. A patient complained of fever, severe headache, dyspnea, heartbeat, physical examination detected pediculosis. In the year of pediculosis, we are talking about what? A louse disease or a lice disease. Okay. So, resola and petisha on the skin of the thorax, bed sores of this blah, 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 blah. Alright. So, this louse disease is also called what? Epidemic typhus. Epidemic typhus. So your answer is B. Don't think too much. Alright. 208. A 3-year-old child died being in deep cerebral coma. Autopsy has shown purulent thickenings in the surface of the pia mater in the frontal part of the brain, cerebral edema. Microscopically, pretoria and neutrophilic infiltration of the pia mater has been detected. What is your diagnosis? Okay. This is definitely meningococcal meningitis. Meningococcal meningitis, a form of bacterial meningitis. Gitis or gitis, whatever, pronounce any way you want it. Just get it correct. Most important thing. Okay, 2 more questions and we are done now. Oh, I'm so happy. Autopsy has shown a plethoric yellow-green pia mater. Plethoric yellow-green means what? Pars or pause or pass. Good. Of the upper part of the cerebral hemisphere, sudden with purulent and fibrous exudate looking like a cap. What disease is this picture typical of? It's your same guy. Meningococcal meningitis. Meningitis. So it's A. Finally, our final answer. If you are still watching me or listening to us at this time, it means you should be able to answer every single question under KROK1 under the discipline Pathological Anatomy. You should be on your fingertips, you should solve it, and you should be smiling with it, you should be enjoying it. Exactly, enjoy what you do. So 210, a microscopic examination of a 5-month-old baby who died of pneumonia has shown oblique slant of palpebral fissures, retraction of the dorsum of the nose, high palate, and low location of small auricles. A defect in the heart and magistral vessels development was detected during autopsy. Genetic examination detected. So why didn't they just go straight and tell us what is 21st trisomy 21? Case closed. Please, your answer is Down syndrome, which is what? C. For Turner syndrome, its karyotype is 45OX. 45OX. Then for Patau syndrome, it's trisomy 13. For Edwards syndrome, trisomy 18. And for, is it Klinefelter or Klinefelter? Whatever syndrome is 47XXY. 47XXY. Beloved, we have come to the end of pathological anatomy. If you enjoyed this video, like it, subscribe, and hey, don't forget to turn on or click on the notification button. Oh yeah, my English has finally come. For more updates. Our next session is going to be on biochemistry. You don't want to miss it. So click on it and let's move. Enjoy your studies and have a blessed day. Peace out. I'm out. See you. Bye.